Hello and welcome to our keynote address today for Rebuilding and Reimagining Our Public Health Infrastructure by Dr. David Michaels. I want to make sure that you all know about how we're able to put this together and thank our various sponsors shown on this slide today. We're grateful for their tremendous support. So today our speaker is Dr. David Michaels, an epidemiologist and professor of environmental and occupational health at the Milken Institute School of Public Health at George Washington University here in Washington, D.C., next door. He served as U.S. Assistant Secretary of Labor for the Occupational Safety and Health Administration from 2009 to January 2017, making him the longest serving OSHA Director in history. He is currently a member of the Biden administration's Transition COVID-19 Advisory Board. During the Clinton administration, Dr. Michaels served as U.S. Assistant Secretary of Energy for Environment, Safety, and Health, charged with protecting the workers, community, and environment around the nation's nuclear weapons facilities. Much of his research focuses on protecting the integrity of science underpinning public health, safety, and environmental protections. And on this topic, he's the author of two books, The Triumph of Doubt, Dark Money, and the Science of Deception, Oxford University Press, 2020. And it's been called a tour de force by Science magazine and a brave and important book raising the alarm about systemic corruption of science, according to Nature magazine. He was also author of an earlier book in 2018 called Doubt is Their Product, which I've assigned for many years in some of my classes. He's an outstanding writer, a wonderful speaker, and a fantastic human being. We're really so proud to have David with us today. Thank you, David.
Well, thank you for that kind introduction, Don. Thank you for inviting me here. It's really a great pleasure. I'm a Maryland resident and eager to be sharing these thoughts. This is a great opportunity, a great moment in public health, given what we've gone through, to think about what our public health infrastructure should look like. So let me share my screen and we will start out. First, let me say, Ramadan Mubarak to all who observe. I think for all of us in public health, this is an exciting time. And let's begin with thinking about the word infrastructure, which we never used to talk about very much. But President Biden's American Jobs Plan includes not just roads and bridges, but clean water, broadband, and home care for the elderly and the disabled. So public health infrastructure, which a lot of people never really thought about before, is really an equally broad concept. Lots of things go into it. It works on the local, state, and federal level. It can involve direct contact with individuals or corporations, offering vaccinations, something in the news at the very moment, or conducting restaurant inspections or workplace inspections, or issuing guidance and regulations to prevent illness and injury. Surveillance is involved in data systems. Public health intersects with the medical care system, of course. There is a great disparity of funding, which we see now. This is before COVID, but here in our country, where we spend more per capita on medical care than any other country in the world, when all healthcare spending is aggregated, public health is somewhere less than 3%, at least before COVID. Now I'm going to focus on one aspect of public health, the regulatory system, which are a lot of the activities and programs are driven by regulation, by law, and those are based, at least hopefully, on scientific evidence. And there's an evidence base for the decisions that we make and the protections we put into place. Now we know about the great success of public health laws and regulation from a number of things that those of you who studied public health have all seen, I'm sure. Just very briefly, for example, tuberculosis, which used to be a very prevalent killer, really began to disappear long before we had any sort of medical treatment successful medical treatment or intervention for tuberculosis. It was laws like the housing laws that said apartments have to have windows, and pasteurization of milk that all had an impact on tuberculosis rates. Excuse me. Another example, because of the Environmental Protection Agency, our air is tremendously cleaner than it was before the 1970s. And the studies have shown that this has prevented hundreds of thousands of premature deaths. Workplace injuries, OSHA is 50 years old. In fact, it's just exactly 50 years old. It opened up its doors April 28th, 1971. At the time OSHA began, there were 37 deaths in the American workplace every day. Now with a workforce more than twice as large, there are about 14 deaths every day in the American workplace. 14 deaths too many, but we have made great progress. And much of this system is invisible, and we take it for granted, at least until it stops working. Many parts of the world, waterborne diseases are highly prevalent. We have this amazing system that in most of the country brings us fresh water and takes our waste away, and most Americans are not even aware how that happens. We only talk about when it flagrantly fails, as it did recently in Flint, Michigan, for example, where there was a very significant lead poisoning and Legionella outbreaks, or just, just last month in Jackson, Mississippi, after extreme weather led to essentially a breakdown of the water system. So the events of the last few years in particular have shined a spotlight on our public health system. And the picture it showed us has not been pretty. First, and this is before COVID, the Trump administration did really damage, defanged or attempted to damage several of the most important public health and environmental agencies. And we don't need to go into detail here, but the damage to the EPA in particular is well known, well documented. And then subsequently came COVID. And with White House leadership who cared more about making President Trump happy than saving thousands of lives and stopping the pandemic, our response was a disaster on so many levels. We started off badly with mixed messages from the White House, an unwillingness to recognize the extent of the problem, to put mitigations into effect. Eventually, CDC documents were edited, or you could actually say vandalized, to fit the White House's political needs. That is all changing now, and we have a dramatically improving CDC and public health leadership. Much of the theory of change underlying the government's and the public health community's efforts around COVID were and still are based on voluntary individual action. This from the World Health Organization, but CDC and all of our public health organizations put out a lot of the same information. And it's important: wear a mask, keep distance, wash your hands, stay home. But that leaves it up to the individual and says, if you do the right thing, it will help, but that's not enough. The federal government is now using some of the authority that it wouldn't use earlier to really make a difference. The CDC, for example, now requires masks on interstate and global travel originating or ending in the United States. That's an effort that had been blocked by the White House previously under the previous president. But it isn't using all of its authority, unfortunately. The most impactful and unfortunate example of this is the unwillingness to use the Occupational Safety and Health Administration, the agency I ran under President Obama. COVID-19 is a massive worker safety crisis with thousands of workers who've been killed, and much exposure occurs at the workplace. Up until recently, especially, for many workers, that was their primary source of exposure. People would stay home, they'd go to work and come back home afterwards. And so exposure took place at the workplace. And until we stop that, it will be difficult to slow the pandemic down. Now, the law is very clear. Workers are supposed to have a safe workplace. That's the law. Employers must provide a safe workplace, and it's the right of workers in the United States to a workplace free of recognized hazards. OSHA has no standards to require employers to protect workers from airborne infectious agents. And so it's very clear what OSHA needs to do, which is to issue an emergency temporary standard, which is something the law says it can and must do in these situations. And experts in worker for this since January of 2020, under previous leadership, Eugene Scalia was the Secretary of Labor, OSHA essentially became an advice agency. And it's good advice. And here's an example of some of the things that the safety tips that OSHA put out. Encourage workers to stay home, encourage respiratory etiquette. These only go so far. They're not bad. They also are the sort of thing that's a little bit different than simply, wash your hands and keep some distance. It says to employers, there are things you can do. What we ought to be seeing, though, is what employers must do, because this is an area where the federal government has great authority. President Biden actually promised shortly after being inaugurated that essentially told OSHA to look into issuing a standard by March 15th. Unfortunately, we're now 4 weeks past that. And OSHA, it's really inexplicable that OSHA should remain handcuffed in what is really the most pro-worker administration in memory. There are many things that people can do voluntarily, but at this point, clearly we can't just rely on voluntary activities to defeat this fourth wave, which is now going on. Now, COVID has also exposed many other gaps in our regulatory system and in all of public health system. The vaccine distribution we have is improving, but it's suboptimal. And we've really learned a lot, but we've had inadequate efforts to actively reach out to populations who have been prioritized for vaccination in minority communities, among so-called essential workers. Something else that stands out is the absence of a national data system that would help us track cases. We simply don't know enough about the impact of this pandemic on subpopulations by race and ethnicity, by industry, by occupation. And we do a very mediocre job tracking the growth of variants. If we had a better data system, collecting more about people and viruses, we better understand these new waves, and we do a better job preventing new infections and therefore hospitalizations and death. Now, during the Trump administration, and this was before COVID, or BC, we could call it, watching the deterioration of our public health agencies like EPA and OSHA, the superficial response of many people, understandably, was to say, look, we've got to rebuild the public health infrastructure. Once we get past this administration, we've got to stop the hemorrhaging of scientists, of the very dedicated staff who left the agencies, got to pump more money in. But I believe that would be a mistake. It's very clear that before COVID and before Trump, the system was inadequate. We had severe gaps and limitations that were only getting bigger with changes in technology and social factors. And that's all been confirmed exponentially by COVID. So let's start with OSHA. And as I said, OSHA opened its doors just 50 years ago this month. The economy has changed dramatically in 50 years. The workforce has changed dramatically in 50 years. 50 years ago, most people who worked for an employer whose name was on the door of the factory or workplace. Now we have also what we sometimes call the fissured workplace. People work for different employers in different places. Huge number of temp workers, contractors, independent contractors, subcontractors, and the whole gig economy. OSHA doesn't really cover all those workers or all those workers very well in any case. The law was based on this old concept of who works for whom. So this is something that Jordan Barab, who was my deputy, I wrote about in the American Journal of Public Health. We made great progress at the beginning of the OSHA era 50 years ago, but right now, if you look at the most recent statistics, they're not getting any better. We've plateaued both for fatalities and for workplace injuries. Those 14 deaths a day, that's the same as it's been for the last 10 years. We have to be able to do better. We can't just let that stay. And OSHA tools are not effective. What does OSHA do? The first thing OSHA does is it conducts inspections. That's what's sort of very well known about OSHA. So OSHA right now has enough inspectors to inspect every workplace once every approximately 160 years. Very difficult to have an effect if that's the way you're working. OSHA issues standards, and standards are very important. That's what we need for COVID-19, because that tells all employers, here's what you need to do. It's really dealing with a problem wholesale rather than retail. And so standards make a big difference. But on average, it takes OSHA more than 10 years to issue a standard for a workplace exposure. We issued a standard in 2016 to protect workers from silica exposure. OSHA started on that standard in 1997, or 19 years earlier. This is one of the reasons there's a lot, the requirements have changed. In the early days, OSHA could issue a standard in 10 pages. The silica standard was 600 pages in the Federal Register, which is about 1,800 manuscript pages. And that takes years to do. And it really means there will never, under this system, there will never be standards for most chemicals. So in 50 years, OSHA has issued standards for 30 chemicals. And of course, no standard for COVID-19 or other airborne infections. So the idea is deterrence. If OSHA is not going to visit you, not to do an inspection, it's got to change workplaces and change employer behavior without visiting. And of course, the best way to do that is to have penalties, and OSHA penalty citation for a serious violation is less than $15,000. So given that, it's not really it doesn't work well, and that's the reason we're not doing it better. A bunch of other issues: presumed innocence. EPA presume a chemical is innocent until they can show that it's guilty. At OSHA, at the body in the morgue method, OSHA can't even think about regulating a chemical till it shows people it's making people sick. And once it's making people sick, of course, then it's too late. You can regulate it, but by the time you regulate, your people have already gotten sick. Many have died, and you've got a long tail on the exposures that will cause people to be getting sick 10, 20, 30 years, even after you've issued a regulation. And it makes it very difficult to regulate chemicals that haven't been on the market very long, or who don't have a lot of people exposed to them. Perhaps the most powerful example in the news these days are the PFAS substances, the Teflon chemicals that are around forever. We have very good epidemiologic evidence on the impact of 2 of them. If you saw the movie Dark Waters, you know a little bit about the history of that. So OSHA could theoretically, or EPA is about to actually regulate 2 of those chemicals. Unfortunately, that class of chemicals has somewhere above 6,000 chemicals, and we have good data on 2 of them. And so there's this presumption of innocence of the other, 6,000 essentially, and we don't really have the ability to deal with them very well. Another important weakness is the challenges of dealing with complex issues where you have to hire engineers. That the federal agencies need a tremendous expertise to take on those complex challenges, and they often don't have that. So they outsource the oversight and the regulation often to the same companies involved in manufacturing the product. The best example of that, tragically, the Boeing 737 MAX jet, that essentially the FAA said to Boeing, you tell us if it's safe. And it was only after 2 of them went down, killing 356 people, 46 people. Essentially did the FAA finally ground the MAX jet, and only now it's be able to fly again. And with tremendous implications, not just for human safety, but for passengers across the world being able to fly. Another huge problem we have across the board are issues of equity. Many of you who look at environmental health have seen the photographs. The worst polluting parts of the country, many of the places where the worst pollution in the country is, have poor communities located right next to factories just spewing out large amounts of toxic chemicals. And those communities, not surprisingly, are generally predominantly minority, often African American. It's true, especially in the South. Preventable illnesses and injuries are much higher in communities of color. It's also related to that racial and ethnic minorities, often particularly recent immigrants, have the worst jobs, the highest illness rates, the highest injury rates. This is from early in the COVID pandemic. It's changing a little bit, but it was very clear from the beginning that the risk of COVID hospitalization death was far worse among minorities. At the beginning, CDC didn't provide information broken down by age and race, but once you actually got that information, you could see it was overwhelmingly among younger people, a disease of African Americans, Latinos, Asian Pacific Islanders, Native Americans. The risks were far, far higher than they were for whites, and that's because of their jobs. People would go to work, they'd be exposed, they'd come home, they live in multi-generational families, they were on public transportation, and they were at greater risk. Of course, when you look at the particular industries where people worked, the dangerous jobs, working in nursing facilities or driving a bus, where minority work or working in farms, workers of color were far more represented in those groups. And of course, those same so-called essential workers, a phrase I don't like, I like to think all workers are essential. These are essential industries. Not only are they more exposed to hazards, they're underpaid. And the percentage of workers who make so little money that they are eligible for supplemental nutrition benefits, the SNAP program, is very clear. So these are essentially previous invisible workers who we now see are fundamentally important for the functioning of the economy and society, who were at greater risk for work-related conditions and poverty-related conditions. So that's a problem that we haven't dealt with at all, and we need to address in rethinking this public health structures. The other area that we really need to think about, which is something that I've focused on in my books, this is one that Don mentioned, which is the science underlying our public health systems is really under attack. And this goes back to tobacco, and the model is tobacco, where a producer, a manufacturer of a dangerous product or a polluter manufactures uncertainty about the science of the effects of exposure to that hazard in order to avoid the policies that might control the market, to avoid policies that make things difficult for that corporation. This approach, the manufacturing uncertainty around science, is well known in not just tobacco, but obviously climate change, a range of different chemicals. In fact, there's an industry out there that does this, that it's a very successful industry. There are a number of consulting firms that make a lot of money, and their business model is producing whatever report the corporation that hires them needs to say, whatever it is, the chemical is safe, tobacco doesn't cause illness, fossil fuels don't cause climate change, et cetera. Now, they don't do the tobacco anymore because that debate is over, and climate change pretty much is over, but there's still debate over, you name the chemical, that debate is going on now. And so that product defense, I call that the Enronization of science. And those of you who remember the Enron Corporation, you essentially had a corporation that supposedly made money by trading energy futures and things like that. It was a house of cards. And when it collapsed, it didn't really produce anything, but when it collapsed, a lot of people lost their jobs, they lost their pensions, stockholders lost their money. A few people made a lot of money. Fortunately, a couple went to jail, but this is sort of science like that. It's building a house of cards. You can do a strategic literature review where you look at every study and you find the flaw and you say, you know what, look, I reviewed 100 different studies and you put them all together and there's still too much uncertainty to regulate this chemical, to protect humans. That's what regulation is, to protect people from this chemical. And they can publish these the strategic literature reviews in journals, which have questionable peer review. The same people do the peer review. And then as a regulator, and I saw this both at the Energy Department and at OSHA, you have to address this problem. And it's difficult as a regulator. And you know this is happening, but at the same time, you have to address it. Where these are scientists who are hired essentially to impact regulation or litigation, to testify in court cases. And their value, and it's very valuable, is not to actually produce science that's useful. In the reason we go into science, to better understand the world, to make it a better place. In fact, I think the science is of little value, but it's a very lucrative approach. So I want to give you one example. The FDA, something it's in the news every day now. This was one company that does the sort of scientific consulting. And this was actually on the web until I wrote about it, so they pulled it from the web. But here's an example of the work that a scientific consulting firm can do. The FDA essentially licenses manufacturers to sell drugs. And there's only, pharmaceutical drugs are very powerful. Obviously, they change the way your physiology, how your body works. And they all have adverse effects, but that's acceptable if they do something that's useful in terms of treating or curing an illness. The FDA will pull a drug from the market for only two reasons: if it doesn't work at all, or if the adverse effects are far greater than its benefits, if its harms greatly outweigh the benefits. So here's an example where a company is boasting about what they were doing here. And so FDA is considering canceling this drug. This group is retained by manufacturers of the drug under attack. So, the FDA is thought of as attacking the drug. It's a war footing or a legal footing. And so the Weinberg Group is hired to define strategy for the administrative hearing, identify experts to be used in the support of the drug, assist in preparation of the written testimony, in other words, ghostwriting the testimony, analysis of the Food and Drug Administration's witnesses' testimony, preparation of oral cross-examination. This led to an extensive process with a written appeal from the first decision to the commissioner, linked to 10 additional years of sales prior to the ultimate cancellation of the drug. So eventually the FDA was successful in getting this drug off the market. But for 10 years, consumers purchased this drug that they probably should never have been on the market. And that's the success of a firm like this. And we see this over and over again. And it's really very challenging for regulators. It's very bad for public health, obviously. And I think it has a bigger impact. It impacts the credibility of scientists and science. And that's something that we're acutely aware of right now with the people who are questioning what leading scientists for public health agencies or for universities say. There's this idea saying, well, we shouldn't believe them. That's fake science, right? That came out of the previous administration. There are a lot of people who don't believe, for example, that masks would be effective in reducing, in hazard control, in reducing exposure to COVID, for example, because there's this sort of anti-science dogma out there. And this is of great importance right now, because think about the challenges that public health is facing right now. There are multiple crises out there: climate change and the increasingly severe weather events that are associated with that, this devastating epidemic of opioid overdoses, the possibility of another, after we control this current pandemic, are other ones coming down the line. So look, now is the time to address this. We've got to not just restore the regulatory component, to get it back into shape, but to steal a phrase, now is the time to build back better. I think there is some hope. This is this is an executive order signed by President Biden, January 20th, the day of the inauguration. It's really a remarkable one. It's something that I think I've never seen anything like this coming out of the White House. essentially it says we need to rethink the way we do regulation. And let me just go down to the next slide here. It says very specifically, we have to look at the regulatory review process to come up with a process that will promote public health and safety, economic growth, social welfare, racial justice, environmental stewardship, human dignity, equity, and the interests of future generations. This is really, really key. It's to say we have to let's go beyond just thinking about costs and benefits and how to, just having regulations that will reduce illness, but let's think about what the impacts really are on all these issues around dignity and equity and the interests of future generations. And when you think about this, and this is really sort of, if you think about this from a larger point of view here, the regulatory system is fundamental to the workings of our economic system. The free market doesn't function without regulation. The rhetoric you hear from the Koch brothers, the Heritage Foundation, claims to be anti-regulatory, but it isn't, because you hear this phrase, regulations kill jobs. In fact, at OSHA, we used to joke, there is no regulation except a job-killing regulation. Of course, that's all false. But in fact, the anti-regulatory fervor that you hear is really just opposed to regulations that its patrons don't like. The attacks on efforts to control greenhouse gases come from organizations and experts supported by the fossil fuel industry. But these industries wouldn't exist but for regulation. So if I can explain, regulations have long history going back hundreds or thousands of years. The medieval marketplace, the basis of individual liberty is the laws and regulations through which governments protect all people from the harms by the actions of others. Market structure and property rights are attempts to ensure that one person's actions don't intrude on the personal liberties of someone else. If a product is advertised a certain weight, it actually is supposed to be that weight. That's an early government law. Participants in the market can't steal from each other. Without the regulatory apparatus of the state, our economy couldn't exist. The state fosters a safe space for market growth. The regulatory system is an extension of those rules to the more complex workings of the modern economy. The objectives of new laws and the agencies empowered pollution or water pollution, for example, but it's to maintain and strengthen that free market that allows that to happen. All of these decisions that are made in the system are based in science. The basic principle of the regulatory system is that decisions have to be made on the basis of the best available evidence at the time of right now. We want stronger regulation, not because we don't care about freedom, but because we can't be free without the state's protection from harm. We need to know that our air is safe to breathe, our food is safe to eat, and that we can return home from work at the end of our shifts no less healthy than when we walked out of the door in the morning. And that's the imperative of the regulatory system and the challenge. So given that, let me end with just really two thoughts here. The first is, given COVID, given that President Trump is in the rearview mirror, we have a new administration. Now is the time to be bold. And we're thinking about that being bold from all sorts of different perspectives, things we never considered advocating for before successfully. Now is the moment to do that. And so we shouldn't hold back thinking about how do we redesign the system better so it really does work for the public. And the second thing is, we won't succeed if we do it alone. We have to organize and together really put these ideas forward. And I hope this is something that a conversation we could all have together and launch really a national conversation of how to make these systems better. So thank you for your patience in listening to me, and I'm eager to hear what you have to say and have a discussion about this.
So thank you, David. That was really fantastic. I will always remember that line. It is regulation that makes us free. Without that, we can't eat or breathe or cross the street. So thank you so much for that talk. And it's my pleasure now to open this up to some questions and discussion.
So Don, it looks like right now, no one has posted a question in the chat space. We're going to encourage attendees to please use the Q&A space. But maybe you could pose a question right now, Don, and then we'll see folks are starting to plug into the Q&A space.
So David, have you had any sense that people who are using this propaganda to undermine the regulatory enterprise are coming to be aware of the problem that they've created by having so thoroughly undermined with much of the population faith in science and regulation as a means of ensuring our freedom and safety, that they may have damaged their own interests at some level?
That's a good question. I'm not in contact with any of these people, but I don't have that sense. I think folks who are involved in the most mercenary activities, where they're really creating science for mercenary goods, they convince themselves that they're right. And I think you have to do that. I think it's very difficult to create these products that say, if you were working for an asbestos company years into this, or tobacco, saying, the studies just don't show that these things are dangerous. I think you convince yourself that you're doing the right thing, you're applying science accurately. And so therefore they probably do not question it. Though I don't know, that's pure speculation. But that's an interesting question. I'll have to look for signs of that.
I wonder if some of the voting suppression response that we're seeing from CEOs is the beginning of that. So we are beginning to get some questions in the chat now. So the first one is about the Johnson & Johnson vaccine, very topical here. What changes do you see being made to public health regulations and policies with regard to the Johnson & Johnson vaccine?
Well, I think, look, this is the first day that we know anything. I listened to the press conference this morning, and I think what's great is that the current administration is trying to be as transparent as possible and say, this is, we've gotten these reports. We're going to pause vaccination. We'll have a big meeting tomorrow of the Vaccine Advisory Committee, and I assume that'll be a public meeting, and people will know why we make the decision. The hard part of this is explaining the risk equation, because at this point the risk from that's being projected is far lower than the risk of COVID, and so how that's communicated will be the challenge. But I don't think the FDA had much choice here. I think if they had said, well, the risk is very low, we're just going to keep pushing on, I think that would have led to a lot of distrust of the FDA. So they really had to do this, but hopefully it won't last for long.
So the next question is very close to my heart, and something that you and I have been collaborating on recently. Do you feel the hesitancy to embrace airborne aerosol transmission of SARS-CoV-2 is impacted by potential occupational exposure liability concerns?
Well, so this is a really important question, and Don is really, one of the world's leaders in understanding and studying aerosol transmission now of the coronavirus, but of other exposures as well. And just to give you some background, at the beginning for those of you who aren't deeply involved in coronavirus response, at the beginning of the pandemic, the CDC and other organizations announced really definitively that this is not an airborne exposure in that you don't have tiny particles traveling great distances, but the primary exposure is droplets, which don't travel very far. And that has big implications for workplace transmission, because then if you're 20 feet away from someone, you don't really need any protection. It was extremely clear to Don, to other experts, to myself, that wasn't true. We had the same discussion with the CDC around H1N1 in 10 years ago, and the CDC and especially the hospitals, the American Hospital Association, has clung to this idea that droplet exposure is the only significant exposure, and that the implications for that is only certain hospital workers need to be protected with N95 masks, for example. And if you work, at the other end of the hospital or just the next room, you don't really need to be in a respirator program. To me, that actually is driving decisions more than liability, because there aren't many lawsuits raised by sick workers. And that even now with COVID, there are very few, primarily because if you're made sick at work and you could show that there's a relationship to work, you have to go into workers' compensation. And that's a no fault exclusive remedy. It's handled by insurance companies, and the compensation is pretty modest. You can't sue your employer in the traditional way if you get sick. On the other hand, so the hospitals don't have to worry much about lawsuits by hospital workers getting sick. On the other hand, it's expensive to put workers into N95s and to change your ventilation systems around to prevent exposure that could travel from airborne particles that go for more than 6 feet. And the hospitals know this because there are other conditions like measles, which are airborne. And so I think that the hospitals are clinging to this idea that droplet exposure is the only important exposure, so they don't have to essentially put in those changes that are quite expensive. I think CDC is slowly changing. I think it's, the science in this case is very clear. There are very few scientists out there who think that, I don't know of any who think there is no aerosol exposure. There is no tiny exposure to tiny particles. And there are some who think, both of them are important, but it means that we really need to be recognizing that COVID-19 can be caused by exposures from some distance away. And the most important thing is to keep clean air moving through indoor spaces. So workers are at risk if they spend 8 hours a day in a workplace where people are coming in and out, especially if they're unmasked. So it has big implications. I don't think it's so much liability, but I think it's costs.
So this, there are several questions that are kind of moving on to getting at your ideas about how do we do this thing next. And one question is, can you discuss a little bit how NIOSH and OSHA interface, and how is this an example of science and regulatory overlaps?
Well, the NIOSH and OSHA have had their ups and downs. When I was at OSHA, well, first I should say John Howard, who has been the longest serving head of NIOSH, and he started there, I think probably 2002, has been a remarkable leader at NIOSH, both helping keeping it moving in the right direction, but also in some very difficult times, during times when Congress did not want NIOSH to be successful or to be funded, ensuring that NIOSH continued to be able to function and be funded. The law is written that NIOSH is supposed to essentially be the scientific arm for OSHA, do the science, do the research. I think the problem facing OSHA isn't that NIOSH isn't supportive or doing the right science, but the OSHA law and the interpretations are such that it's almost impossible to get a standard out. It just takes so long. NIOSH is incredibly helpful. When we were working on our silica standard, NIOSH scientists wrote very supportive comments. They provided us all sorts of analyses. They were particularly helpful at the hearings. We had one hearing where there was a fellow named Tony Cox who was working for the American Chemistry Council. And this is one of these product defense experts. He had actually he does a lot of work for the fossil fuel industry. He worked for the National Mining Association when they were trying to improve protections from coal dust. And he said, oh, that all that black lung stuff is really just silica. When the silica standard came up, he actually stood up at a hearing and said that OSHA had not proven that silica causes silicosis. Of course, and at that point, NIOSH, one NIOSH scientist, Robert Park, got up and said, do you think we're stupid? And really defended the process. So NIOSH has been great in this. I specifically identified Tony Cox by name only because once the Trump administration began, he was named the head of EPA's Clean Air Science Advisory Committee and was the person most responsible in that world to make sure that EPA did not strengthen any of its air pollution standards. Now, hopefully that's all in the past, and we'll have stronger advisory committees, and we'll have really OSHA be able to change the way it issues standards so NIOSH can support it better to better protect workers.
So, there's several questions thinking about, so what is the path forward? How do you envision this creative response to this?
Look, I think it has to be, first, I think we need a national discussion, just as we're having, and that comes out of, it's great if that's led by the White House, and we're having now this incredible national discussion about offshore taxes and things like that, which we, a few years ago, you would never have thought that would have been of interest to the administration. I think we have to make it clear to talk about, well, what do we need to do to protect people from hazardous exposures? And this idea of separating out workers and the public, is crazy. We need to say, let's protect everybody. Now that's going to require a legislative change, but we can look at other countries, how they think about this. There are a number of countries that have now moved out of this idea of thinking about an employer has to protect their employees, because it obviously doesn't work anymore. And so in Australia and New Zealand, for example, corporations have a duty of care. And that says that if there's something that the corporation is doing, producing a product or polluting, they have to make sure it doesn't hurt people. It doesn't make a difference if it's a worker or a pedestrian who walks by or someone who buys their product. And then you could have the same standards, the same application, the same science that applies across the board to say, okay, this is what a safe level of exposure is, and here's a potentially unsafe level. And in some ways, right now, the exposures to workers the exposures that are permitted in workplaces are generally far higher than the exposures permitted to the public. In some ways, it should be the opposite, because workers are exposed in many cases for 8 or 10 hours a day, while the public can be exposed, to lower levels, it'll be more time, but the exposures are really quite different. So you need protection in the workplaces, and we don't have anything like that now.
So, how in this environment, how do we deal with this epidemic of misinformation and disinformation?
Well, there are some immediate steps we can take. I think first thing is it has to be very clear when someone pays for a study to be done, that has to be front and center of when it's presented. To some extent, the science journals now require that. But what's interesting is we don't have that same requirement for federal regulations. If you put in comments or if you put in a study to an EPA docket, you don't have to say who paid for it. Or if you put it into Science Magazine, you do. That was something that we did for several standards at OSHA. We're the first agency to do that. And it was, for some reason, it was controversial. We said in our silica standard and our beryllium standard, if you are being paid and there's any potential conflict of interest, you should report it. We didn't say you had to, because government agencies must accept comments anyway. You can't just discard comments. But we said we would treat it differently if you don't assert who paid for it or you had no conflict of interest. That was controversial enough that I was actually called down to the Senate by there was a letter written by 13 Republican senators complaining that this would discourage people from sending comments into federal dockets if you had to say who paid for them or if you had a conflict of interest. Fortunately, Nature magazine wrote a very strong editorial. We stuck to our guns. The members of Congress couldn't really do anything. I don't want to say they backed off, but they really could not change it. And I think that's the sort of thing we should be talking about. We should be saying, requiring that sort of conflict of interest disclosure in all of these discussions. Unfortunately, it's probably not enough now in that a lot of these areas, like around looking at the science around climate change, has become so tribal that there are people, you don't need to pay people to misread the data. And so I think that's a bigger issue and we're gonna have to wrestle with it.
So can you then talk about what is the trade-off? Are there trade-offs? Yes, regulations are necessary, but are there trade-offs between more regulation and economic benefits?
Well, you have to look at it carefully, but there were studies that were done of OSHA regulations. And these were a number of years ago when Congress still had an agency to do these studies. But the accusation of job killing regulations was one that was looked at very carefully. And that was even at the very beginning, vinyl chloride monomer is a very powerful carcinogen. It was recognized when there were 5 cases of a rare liver tumor at one plant in Louisville, Kentucky, where they were making vinyl chloride, they were polymerizing vinyl chloride monomer. When OSHA went to issue a standard, the industry actually said it threatened 2 million jobs because that was the vinyl industry. And OSHA went ahead, they issued the standard, and within 6 months, the very innovative engineers of the chemical industry figure out how to enclose the feedstock. And so not a single job was lost. In fact, the industry became more profitable as a result. And it turns out that regulation drives technology. But when OSHA estimates the cost of regulations, it can't take technological change into account. So what studies have shown is the cost of regulations, not only is it always far less than every industry claims it will be, because they will inflate the costs to the sky, but even the cost that OSHA estimates of what the regulation will cost employers is always an overestimate because people figure out cheaper ways to do things and it increases productivity rather than decreases it.
Thank you. So when should OSHA be doing things like, and one approach to dealing with this is having all employers do hazard assessments and be transparent about the data they collect?
Yeah, in some ways that's more important than any individual standard. I mean, clearly this is something that OSHA should have done many years ago, and we tried to do that but didn't have the bandwidth. Essentially, every employer should have a safety and health management system, which is based on essentially hazard assessment and then application of whatever factors, mitigation efforts are necessary based on that hazard assessment. Jim Thornton, who was the safety and health director of the big shipyard in Newport News, the Huntington, it's called Huntington Shipyard, it used to be Tenneco. He said to me very early in my time at OSHA, he said, every employer has a health and safety management system, just some of them don't know it. And the ones that are good essentially have this hazard assessment. You say, what's going on in our workplace? What are the hazards and what are we going to do about them? And that should be every employer's responsibility. And it's sort of pretty amazing that it's not. And if I could pass one standard, that would be it, saying that's what you need to do. And that would apply as much in a steel mill, as a hospital, as an Amazon warehouse.
So we still have a few more questions here, but I'm getting messages that we may need to be moving on to our closing slides in a minute. And there's a lot more to talk about, for example, do you see the multiple pandemics, and of climate change, of environmental justice, gun violence, all coming together? And do you find the term syndemic useful way to think about this?
You know, I don't know if it's in terms of thinking about them all together that way, but I think we have to, they all are this sort of very compelling evidence that we need to address all of them in a different way. I don't think we're there yet in how to do that. And this is the moment to do this, thinking about this. We have to be, and this is for the public health community, to be thinking about this, to be writing about this. How can we change the way we work, how to change the way we think to address these problems, some of which were obvious before COVID, but others which have clearly been identified, that it's really, you know, now is the moment to be bold and to address them.
So Aaron, are we ready to move back to the final slides?
We are, and I don't know, Don, you may want to, do you have any closing comments as well as moderator?
Well, I want to just thank David for coming today, and it's always great to hear your deep insights into how the government works and how this whole regulatory system works. As a researcher in a particular area, I tend to go down my rabbit hole, and I know a lot about what's down there. And it's always refreshing to come up and get this broader view that you have of what's going on. And I think that some of the things that we're thinking about, you know, how do we get there? How do we get to requiring workplaces to do hazard assessments and do that jointly with employer and employees, workers, joint labor management committees together? These are difficult problems, and I think it's really encouraging that the new administration is looking at how do we at least begin the discussion of how we get there. It's not going to happen overnight. We didn't get into this mess overnight.
I agree. Well, thank you for inviting me. This has been fun.